You're watching The Source on CNN Philippines. I'm Pinky Webb. Health Secretary Ted Herbosa said he intends to work on fighting for better pay and improved working conditions for public and private nurses. He said healthcare workers must be given a competitive salary to encourage them to stay in the Philippines. The government is working to fill 4,500 nursing vacancies in public hospitals. Let's go straight to the source of the story. We have House Civil and Professional Regulation Committee Chairperson and Bohol 3rd District Representative Kristine Tutor. Congresswoman, it's good to finally have you. I've been wanting to talk to you for the past weeks. Thanks for your time.
Thank you po. Good morning, Pinky.
Okay, pag-usapan na po natin briefly yung proposal ni Secretary Ted Herbosa. He wanted to possibly give temporary licenses, the PRC of course, to give temporary licenses to non-board passers, but who got a score of 70 to 74. What were your thoughts upon hearing this way back?
Yes, Pinky, I still remain to statement that I stay true po sa principle po natin na I do not concur with Secretary Ted na we have to give temporary license. Kasi yung sa RA 9173, it does not state so that they have the authority, the PRC or the DOH has the authority to issue licenses. So, hindi po pwede kasi ang dami po nating unemployed licensed nurses ngayon na wala po talagang trabaho. So why not give the priority to them rather than those na magte-take pa lang ng board?
Opo. So yun din po yung position ng PRC. And I did read in the past, that was also your position. Unless, of course, the law is amended regarding this. But you talked about 4,500 vacancies, ano po, and that we should tap those who have already passed the board. Any proposal on how to entice or encourage them to be able to fill up the vacancies that we have in government hospitals?
So to fill up naman yung vacancies po natin, Pinky, meron tayong problema, the minimum wage rate natin. Kasi yung public and private hospitals natin, as to the nurses, malaki kasi yung disparity. And that disparity belongs to the wage rate. The public hospital nurses are more significantly better situated than the private nurses kasi mas malaki yung sahod nila. Like DOH nurses, they start with an entry-level salary grade of 15 and that is around 36,000. Whereas, yung sa private nurses natin, sa mga private hospitals, dito lang ako sa Region 7, particularly in Bohol, I've heard as low as 12 to 15,000. More likely, below 20,000. So, malaki yung discrepancy, the disparity, the 36,000 versus the below 20,000. So, we need to bridge the gap of the wage rate between the public and the private nurses para walang para wala tayong shortage and we can entice them to come rather than to go abroad, to go overseas kasi nagkaroon na tayo ng overseas exodus of our nurses as of the moment.
And that continues. Pero paano ho kaya, sabihin po natin, yun po, that's also the data that I've been using more or less, 35,000 sa public, about 15 to 18 po sa private, no, more or less. Unang-una, even the 35,000 that is being offered to nurses for government hospitals, there are hardly any takers. Kaya po may bakanting 4,500. I guess the question is, ano ho pa ang pwedeng gawin ng gobyerno para po with a 35,000 salary, tanggapin po nila yung trabaho?
So, ganito po. What we can see as solution is first, we have to establish a minimum wage rate, most especially for the private nurses. So, around 700 to 1,000 per day net. That is already like just and fair naman sa ating mga private nurses. Then secondly, yung problema natin sa mga PhilHealth remittances to the private hospitals, ang daming backlog at saka delay ng payment to the private hospitals. And these are one of the reasons kung bakit meron tayong struggling financially sa ating mga private hospitals. Then another thing is we have also to fill the vacant nursing position, the health personnel in the DOH. Ang dami kasing unfilled position natin on the health sector. Then another thing is we need to include in the amendment of the nursing law to enable the PRC to issue licenses in addition to the other types of nurses. Like for example, the nurse practitioners, the nurse assistants, the nurse aide. And we have also like a solution like to hire more contractual and job order nursing assistant and nursing aides para ma-reduce natin yung workload ng ating mga registered nurses. But most importantly po, Pinky, ang nakikita ko is to lift the ban and the deployment sa ating mga nurses who are going abroad. We have to increase it and maybe double the deployment of our nurses.
Yeah, because I think...
Yun yung nakikita ko.
So, doblehin pa po yung mga nais o pwedeng mga ibang bansa para sa inyo. Taasan yung cap.
Yes po. So, I concur with the statement of PNA President Meldon Miranda po. Yung sinasabi niya na talagang dapat nating i-ban yung lift and to increase the deployment. Kasi nga, if we cannot answer the minimum wage rate, if we cannot bridge the gap of the minimum wage rate between the public and the private hospitals,
Opo.
hindi talaga natin masastop yung overseas exodus ng mga nurses natin. Kasi mas better situated sila doon kaysa atin.
In fact,
because of the wage rate natin.
yeah, you know, Congresswoman, in fact, when this kind of conversation is discussed, no, on the disparity ng mga nurses sa public at sa private, meron po akong mga nakakausap na nagugulat na bakit ang laki ng diferensya ng government and private nurses. But more than that, I think also is, I guess, how to move forward with this is, are you looking at possible benefits, parang more benefits for our nurses so that they will just decide to stay here? Meron ho kayang, is there any proposal that could be viable?
Yes po. Yung salary standardization law natin, we can have the sixth salary standardization law, yung sa 2025 to 2029. Tapos yung labor code natin, i-amend natin to reduce the regional wage tiers of the current number natin na 3 to 4, gawin natin to 3 to 4 regional groupings din natin. So, those are the things. Tapos, yung mga enticement naman natin, gaya ng sabi ko, we have to bridge the gap sa minimum wage rate sa mga private. Sa private nurses kasi, doon yung problema natin. Doon yung maraming migration na stronger talaga yung migration sa private nurses kasi nga, lower yung mga wage and compensation nila. So we have to address that issue para mawala yung mga natin, migration to abroad.
Okay. So, kayo ho ba, are you in favor of giving, sabihin po natin na ma-amend yung batas, amend it to allow temporary licenses to non-board passers? If the law were to be amended that way, is that something you would support?
I would support that provided lang po na we have to give more priority po muna sa mga unemployed license. And if there are no more qualified unemployed licensed nurses, then that would be the time that we have to employ yung mga board takers pa lang po.
Opo.
So give priority muna sa mga unemployed.
So parang kailan may intervening circumstance?
Yes, actually, Pinky, we already have the ongoing amendment po sa nursing law natin. It's pending in the Committee on Occupation.
Okay. Let's use another time to talk about that. House Civil and Professional Regulation Committee Chairperson and Bohol 3rd District Representative Kristine Tutor. Ma'am, thank you so much for your time.
Thank you, Pinky.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.